Hi everyone, welcome to Small Talks with MyWellbeing. I'm your host, Dr. Courtney Bancroft, otherwise known as NYC Sleep Doc on Instagram, and I'm a clinical psychologist specializing in all things sleep wellness and insomnia. The question I'm answering today is one that I get asked the most often from people hoping to achieve sleep wellness, and even from magazines, podcasters, and other media outlets. Everyone wants to know the answer to the question, what are the basic tips for getting a good night's sleep? And it's no wonder everyone wants to know the answer to this, because sleep is vitally important to our health, our mental health, and our overall well-being and mood. People who sleep less than the recommended amount of hours on an ongoing basis are at risk for many different issues, including medical and mental health issues. So where do we begin? First, we need to know what's considered normal. Most adults need 7 to 9 hours of sleep per night, but really this can vary based on a number of factors. Additionally, I want everyone to know that waking up throughout the night is normal. I cannot stress this enough. Long before alarm clocks, our bodies were built to include checking mechanisms to make sure we're safe, comfortable, and that our needs are being met throughout the night. This is why it's okay to briefly wake up throughout the night. The brain and body are simply checking that all is well and that it's safe to continue sleeping. Lastly, most people, even good sleepers, have trouble sleeping every now and then. This is also normal. Sleep performance can change when there are changes in environment, stressors, loss. These episodes of sleep disruption usually resolve on their own with time. However, they can sometimes turn into a diagnosis of clinical insomnia. And clinical insomnia is defined as a problem falling asleep, staying asleep, or waking up too early. It has to happen at least 3 times per week for a period of at least 3 months to meet criteria. The gold standard treatment approach for individuals with insomnia is called Cognitive Behavioral Therapy for Insomnia, or CBTI. This specific treatment is an evidence-based 6 to 8 week program that is effective in over 85% of cases, even more so than medication. So if you suspect you have insomnia, it's best to find a practitioner like myself who's been certified and trained in the therapy. The outcomes are amazing. Now, let's dive in to discuss the main tips for good sleep. The first has to do with environment. It's so important to make sure your environment is sending signals to your brain that it is okay for sleep to come. Your circadian clock is the part of your biological system that's in charge of sending these signals, and when the signals from the environment line up to say it's time for bed, our circadian clock begins to produce melatonin in the brain and give the go-ahead for sleep. In order to do this, your brain needs to check a few things off the list first. It's going to be checking whether it's dark or light, warm or cool, whether there's food in your belly to digest or if it's time to rest the system, and whether you're standing up or laying down, as well as other factors. If your brain is getting conflicting information, like you're ready for bed but the lights are all on, then it's not going to give the 100% okay that it's time to sleep. So, environment is key. If you've ever heard of sleep hygiene techniques, these are usually the ones that target the environment. The second has to do with your appetite for sleep. Just like with food, your body has to become hungry enough for sleep. So there needs to be a good amount of time that's passed since you last slept so this hunger can build up. If you recently took a nap or slept extra long the night before, it will take longer for the body to build up the sleep drive's appetite. The third and final component of good sleep is safety. And what I mean by that is that the brain and body are constantly getting messages about whether you're safe or not. And in order to fall into a deep sleep, we technically are pretty vulnerable during sleep from an evolutionary standpoint. So we need to take some time before bed to set up a calm, soothing, secure, safe environment, both in body and mind, so that our system doesn't sense any type of threat. If it does, it will override sleepiness and the messaging to the circadian clock in order to keep you safe. So remember to send signals of safety to the mind and body and set up a nice buffer zone time before bed to wind down. So to recap, set an environment that promotes sleep, make sure you have a strong appetite for sleep, and make sure your body and mind know that you're safe enough to fall asleep. These are all the tips I have for you today, but if you're interested in improving your sleep wellness, want to work through insomnia, or are interested to hear more, please follow my Instagram account at NYCSleepDoc or visit my webpage, www.drcourtneybancroft.com. Otherwise, I hope this small talk was helpful for you today. Please feel free to comment and share with any friends who you believe would benefit from this talk. Thanks to MyWellbeing for having me as a guest host. Wishing you all the best and a good night's rest.